Hello everyone. Today we'll be looking at the third part of the question and answer series of tooth morphology. We had discussed around 18 questions so far, and now we'll be looking at further question. The question is, name the surface of the tooth that faces away from the midline while following the curve of the dental arch. So it is away from the midline. So this surface is known as the distal surface. The surface that which is towards the midline is known as the mesial surface, while the surface which is away from the midline is known as the distal surface, and in combination both these surfaces are known as the proximal surfaces. So the next question is, name the surface of the tooth that faces towards the tongue. So it is known as the lingual surface, while if it is towards the palate, it is known as the palatal surface. Now, this is an easy question. Name the teeth considered to be the anterior teeth. So the anterior teeth are central incisor, lateral incisors, and the canines. And these types of teeth are present both in the maxillary arch as well as the mandibular arch. Now, name the teeth that are considered to be posterior teeth. So posterior teeth are the first premolars, the second premolars, the molars, the first molar, the second molar, and the third molar. So all of these 5 types of teeth are present both in the maxillary arch as well as in the mandibular arch, and they are considered to be posterior teeth. Now, what is the general term that is used to describe quantitative defects in enamel? So the defects in emelogenesis are the quantitative defects in enamel are known as enamel hyperplasia, and they usually represent quantitative defects of enamel. So what is the general term used to describe the qualitative defects in terms of quality? So this is known as hypocalcification, are actually qualitative defects of enamel, and they are also referred to as opacities. They are clinically visible, or they clinically present as opacities. So what number of weeks in utero does calcification normally begin? So when does calcification and mineralization of teeth usually initiate in utero? So 14 weeks in utero it usually starts, and it is initiated for the maxillary and mandibular central incisors of the primary dentition. Now, at what age can the emergence or eruption of the primary dentition usually observed? So when does it actually start? The eruption of the primary teeth. The eruption of the primary teeth usually starts at the age of 6 months, and the primary mandibular central incisor is usually the first milk tooth or deciduous tooth to erupt into the oral cavity. Now, at what age is the eruption of the primary dentition usually considered to be complete? So primary dentition is usually complete by 30 months or 2.5 years. The primary dentition has all of the primary teeth have erupted into the oral cavity, but their apices are still not formed. Their apices usually form by 3.25 years of life. So the next is, calcification of the primary dentition occurs both in utero and postnatal. So is this statement true or false? So this statement is true. The calcification also starts in utero for the deciduous central incisor, and the crowns are not fully completed in the deciduous maxillary second molars until about 2.5 years of age. So this is another statement. Calcification of the permanent dentition occurs both in utero and postnatal. Now, this statement is false. Why? Because the calcification of the permanent dentition is entirely postnatal and starts just after birth. And the first evidence of calcification of the first permanent molars is usually seen at the time of birth. So, premature loss of primary teeth are of no significance. Is this statement true or false? So, this statement is false. Premature loss of primary teeth can lead to significant issues in the development of and eruption of the succedaneous teeth, such as crowding or impaction, and there are potential problems with spacing and alignment issues. And that is why primary teeth or deciduous dentition are the best physiological space maintainers. So where are the follicles of the developing permanent teeth found relative to the primary tooth roots? So the answer to the question is that they are found usually lingual. So the developing tooth follicles of the succeeding teeth are usually found lingually and apically to the primary tooth predecessors. This is for anterior teeth. Now, under normal conditions, what must happen to the primary incisors before the permanent incisors can erupt into the oral cavity? So before the permanent incisors they erupt into the oral cavity, the deciduous incisors they need to exfoliate or they need to shed. So what are the 4 or more centers of calcification or formation of a given tooth known as? So this is the last question. The centers of calcification are known as lobes, and they are used to describe the primary parts of the tooth or the morphological divisions on the crown of a tooth. So that is all for now. Thanks for listening.